how'd you guys get into, what you're into now? How'd you get into, you've been a doctor, I'm sure, for many, many years. How'd you get into HRT?
Well, obviously, I lifted in the 70s and the 80s, so we all know what that means. The gym I started at in Peoria, Illinois, was a good powerlifting, bodybuilding. Anybody that was anywhere went there. In fact, you certainly have heard of Mike Bridges.
Absolutely.
That's where Mike Bridges trained. And, we were all using anabolics. It was just part of it. So I always had an interest in it from that perspective. And then I got old, and I've been doing this as a patient now for about 8.5 years. My wife and I started it together, and we were in our 50s. I'm 67. And so was I 59 and she was 56. So we, would kind of look at each other as we aged. And, it's not like we're in our 20s. And we kind of laugh. But the menopause that she was going through was really hard. And finally, we just got to points that, we're not doing this anymore, and wound up taking this journey. And now this is what we do as a business and a practice. Jeff is heavily involved in it. To me, my thinking is actually my motto: zero frail old men. One of the things that just drives me crazy is when you see these skinny fat guys. They're fat, but they have skinny arms and skinny legs. And I'm like, good God, you get off the couch, grab a barbell, put it overhead, put it on your back, do some squats. Yeah, and probably get on some testosterone. Be a for God's sake. It's hard as you guys aren't there. But as you get older, you start looking around going, how am I doing? I think I could kick his ass if I had to. And that's kind of what you do when you get older, because what do you compare yourself to? Not when you were 20. So I think I'm doing okay for my age. But my weight class was 242, and I usually weighed around 240 with a 33, 34-inch waist. And now I'm weighing 238 with a 42-inch waist. Not now, but before I started. Yeah. And one day, I was kind of like, I'm all right. I haven't gained weight. I'm still in my weight class, for God's sake. But yeah, everything that was up here moved down. Everything that was down moved up. It's all centrally located. But I was sitting on the toilet one day leaning forward, and I'm, whoa, what is this here? And kind of, I got some fat. I didn't really. And again, I think I just kind of didn't focus on the truth because you don't want to. And that's when this has got to stop. And about 2 weeks after I started, and of course I knew what to expect. I'd done this stuff at a different level, of course, but I felt better in 2 weeks. Just walking around, I felt better. And I was thinking, good God, I didn't realize I wasn't feeling good. I thought I'm okay. And you always get that qualifier, okay for your age. But this was incredible. And of course, it just continued to improve from there. My lifting improved because my joints didn't hurt as much. I had more endurance, so I could get more reps. Usually what would hold me back is I'm doing presses. I think my shoulder's going to explode. I better not do a rep. Well, now, my shoulder's not hurting. So I was able to train at a little higher intensity. I'm not doing the lifts, of course, but I started gaining muscle. 6 months, I lost 5 inches off my waist, seemingly overnight. I used to joke around and tell guys, I'm spending more money on new clothes and alterations than testosterone. But now I wish, and my wife and I were the same, we look at each other, wish we'd have done this 10 years sooner. So I bet if I'd have done it at 49, I'd go, God, I wish I had done this at 39. And to me, it's just maximizing your life. It's a lifestyle choice. I tell almost every patient, you are not sick. And they're not, but they're 45 and they liked it better when they were 25. Well, we can do something about that. And that's what we do.
And so
extremely rewarding.
So when you got on testosterone, was it just testosterone and you felt all these benefits just from that?
No, I was also taking anastrozole. And back then, the most of the TRT doctors that I knew about and talked about, heard from, that was the concept that you want to manage estrogen and you want to keep it in that sweet spot. And I did that for 3 years. Then I started going to Neil Rousier's program. I don't know if you guys have heard of him, pretty well-known TRT hormone replacement doctor. And I went through all of his post-grad courses. I'm certified through him, and he's very much anti-aromatase inhibitors, let estrogen go. So I thought, well, I'm going to stop this and see what happens. And lo and behold, my cholesterol levels improved 20%. My joints felt a lot better. I have pretty high cholesterol or estrogen, 0 side effects. So in the office, we don't use the aromatase inhibitors very much at all. We've had guys that were able to go off of cholesterol medication and high blood pressure medication and even diabetes medication. Once they get their hormones optimized, get their testosterone up, they lose the visceral fat, and with it, their cholesterol markers improve. What's the worst thing in the world for somebody health-wise? Visceral fat. It's that visceral fat. Insulin sensitivity goes down. So you can lose that fat. Now, obviously, I encourage everybody to lift. I think everybody should work out, do strength training. Most guys do, or at least a lot of them, but we have some that they don't. They just sit on a needle once a week and they get great results.
It kind of makes
I'll talk forever if you let me go, so just interrupt.
Yeah, this makes me curious.
Yeah, please. I'm serious.
You mentioned that, you started at 59 and you knew you'd start at 49. And if you knew earlier, you'd start at 39, right? So it gets me curious, when does a man, when is the right time for somebody to start doing something like that? Let's say, are there certain numbers he should be looking for? Oh, okay, I am too low. Or if his numbers are good, is there even a reason to? You know what I mean? So what should he be looking for?
Most of the guys we see that come in, they're interested in testosterone because they're losing energy or lacking energy. They're tired all the time. They want to be more muscular. They want to look better. They're a lot more workout guys, and they want to look like they work out. And a lot of them poor libido. So pretty much for us, it's increase their sex drive or sexual function and gain some muscle. Look like they work out. So that's really it. We don't focus on numbers. I know I'm talking out of both sides of my mouth. So we look at these lab values. We look at reference ranges. The total testosterone range is 250 to 1100 through Quest, the lab we use. The free testosterone is 35 to 155. It's a big range. Mm-hmm. Tell everybody we're looking at these numbers. We're using this as a marker to give us some direction as to what your options might be and as a reference point moving forward. Then on the other side, I go, I don't give a shit about these numbers. How do you feel? If your testosterone level is 700 and you don't have a sex drive, we're going to do something about that. We're going to increase testosterone to get you feeling good. Next question is, well, where do you draw the line from? Now we're going from a testosterone restoration to the next step, and we're running cycles. I haven't had anybody, I think, really push that yet. We do have guys, I just got off the phone with one, his total testosterone was 1,500, and his free test is 260. So he's high, and he's with us for a few years. And that's pretty much where he's been. I looked at his previous 3 labs and very consistent. He feels great. Everything regarding all his kidneys, liver function, lipids, his blood counts, everything looks great. So we're good. He's happy. He feels great. He's actually my age, exactly my age, almost a month apart on birthdays. He's like, you got my life back. So I don't know if that answers your question satisfactorily. We don't draw a line and go, well, when you go before 400, we take you, or 250. A very typical patient will be a guy in his 40s who's tired, got the bellies, gained weight, his sex drive's down. His wife thinks he's having an affair because she's not seeing anything. Or maybe their marriage is just not what it used to be. They've been married a few years, and she's looking at him going, you bastard, you've gained 35 pounds. I've gained 5. You don't find me attractive? What's wrong here? Well, I don't know about you guys. I'd be depressed. If I was fat and tired all the time and not interested in having sex with my wife, I would be very depressed. So they go to their GP, and even if they check their testosterone, well, 250 to 1100 is a big range. So they come back at, pick a number, 300, 400, 500. You're fine. You're normal. You don't need testosterone. Let me give you an antidepressant. So they give an antidepressant and nothing changes, except they're happy because they got a brain chemical screwing with their head. Their wife is still unhappy. He's not interested in sex with his wife. He's tired all the time. He's still fat. He's not functioning at work. And that is a very classic presentation to see. The wife will come in with him because they want to make sure I get the full story. As soon as I see a woman in the room with the guy, I know exactly what's going on. And what often happens, I always tell a wife, I said, now be careful what you wish for here. What often happens is 5 or 6 months later, the wife's in the office. She's like, yeah, I can't keep up with him. I'm going to have to do this too. So really good way to build a practice, right, Jeff?
That's right.